My name's Sophie Hill. I live in Melbourne and I work at La Trobe University. I'm the head of the Centre for Health Communication and Participation, and I'm also the coordinating editor of the Cochrane Consumers and Communication Review Group, and I'm going to be talking very briefly about our new book, The Knowledgeable Patient, Communication and Participation in Health. At the Centre we promote the concept of evidence-informed communication and participation, and by that we mean informed by evidence and also informed by consumers' views and experiences. There are some key ideas in this book. The first one is that better health outcomes come about by combining scientific approaches with democratic participation. And by this we mean learning from research and learning from each other. The other main idea in the book is that although we use the term communication and participation, we actually mean a very diverse range of ways in which people interact with the health system. We also want to imply that communication is multi-directional, so that information could come from consumers as well as information being imparted to consumers and health carers. So by this we mean that communication could imply that we want to inform people about their health, or it could imply that we want to enable them to minimise their risks when they're taking their medicines, or it could also mean that we're seeking different ways in which people in the community can be involved in health activities and communicating with us about their needs. All sorts of topics are covered in the book: surgery, how consumers use the Cochrane Library, communication skills training, what are communication interventions, what are the outcomes we're seeking, what do we mean by public participation in research, where are there resources and tools that we need to understand evidence-informed communication and participation. The chapters in the book has been conducted with all different kinds of methods, so it's not just about systematic reviews. There's also qualitative research, secondary analysis, knowledge transfer research. This book was written for people who are interested in a consumer perspective on health, who are interested in evidence-based healthcare, and people who are imagining a different kind of health system. So they could be people at university studying health courses, medicine, nursing, health policy, public health. It's also written for people who are working in community organisations or in health services, who are responsible for consumer engagement, consumer participation. That's enough from me. Thank you for listening.